Data obtained through a Freedom of Information request by policy think tank Second Street sheds further light on the worsening healthcare crisis in the province. From 2023 to 2024, over 4,500 British Columbians died while awaiting a diagnosis or surgery. And Cobble Hill's Melanie Leeson nearly found herself included on that list after being diagnosed with an aggressive form of abdominal cancer in January of 2023. Facing the fight of her life, Leeson trusted that the system would be there for her, but then weeks turned into months without any progress.
This is a few months after I'm diagnosed, and I have what is considered a very aggressive cancer. What's happening? Why am I still sitting here with no treatment?
Not knowing when or if she would be treated, Leeson began searching for alternatives, eventually finding the Mercy Medical Center in Maryland. Upon arriving in Baltimore, her surgeon with 35 years' experience was stunned with what he saw.
He was appalled that I hadn't been treated. He said, they found this out in January and you're here in April? He said, what are they doing in BC? He couldn't believe it.
In Baltimore, Leeson learned just how much her life was worth, spending over $200,000 to receive the urgent care she needed and a second lease on life. But her story is far from unique.
For patients, we're sorry. We're sorry. We're working as hard as we can. There's not enough of us to go around.
Frustrated with what it sees as a lack of action from the province, Professional Association Consultant Specialists of BC has launched a new campaign called Every Story Matters, calling on the province to implement a referral database to better understand the gaps and how they can be filled.
We don't have a map of British Columbia with a sense of where specialist care needs to be bumped up, And so as the province is bringing people here, we're like, well, what type of doctor needs to go where? These are questions that the ministry has zero data for.
The Minister of Health says she looks forward to learning more about the proposal and working alongside healthcare specialists to ensure British Columbians receive the best possible care. Back on Vancouver Island, Leeson says she remains grateful for those on the front lines.
They were working so hard to make sure that they were doing the best they could for you. They're overworked, they're overwhelmed, and they're trying their best.
But she believes that even their best would not have saved her life. In Vancouver, Kurt Black, City News.